So, hello, good afternoon, good evening, good morning. Welcome to the ADHD Reframe Project with me, host Emma. Um, and yeah, this is exciting because we're on season 2 now. So today I am joined by Osayomore. Would you like to just do a little bit of an introduction to yourself, please?
So, hello everyone. I'm Osaymore. I'm a pharmacist and specializing in ADHD. And yeah, I'm joining Emma today for our chat.
Yeah. So, do you work specifically with ADHD people, don't you? So, what is it
Yes, I do.
exactly that you do?
So, I work as a ADHD specialist pharmacist. So, I review patients and prescribe and titrate to patients, help them manage side effects, and um, just in general, not just medication sides, but also just psychoeducation and helping them thrive, really.
So how did you get into that then? It's fascinating.
Yeah, it is actually. So I've been a pharmacist for 11 years roughly. So I have done community pharmacy, did a bit of health and justice, GP surgery, and then so I've always kind of been in the space of social media as well. So back in when I finished university, I started a website where I document my journey as a pharmacist. So I've kind of always been on social media, and then recently came across a report. I'll probably say maybe about 2 years ago came across about a report about the increased number of misinformation on the internet about medical conditions, especially mental health, ADHD. And that sparked my interest really on ADHD. And then I started to specialize. I've done my training a bit more like a deep dive into ADHD and how to manage patients with ADHD. And yeah, so it's just made, I would say, the sheer amount of misinformation out there got me motivated to try and put in more evidence-based information out.
So, um, how was that kind of what steps have you taken to get more information, like specific information out to ADHD people that need it regarding medication?
So regarding medication, I do spend a lot of time on my LinkedIn lately, posting about medication on there. I do a couple of videos, not so much as I can because I'm still working. So I'm still working full time. So I try to fit it all in. It's it's a bit of it's crazy over here as well. No, just before we start recording, we're talking about how we're juggling different things.
Yeah, yeah. And also talking about welcome to the madhouse, aka me. So do you specifically prescribe and titrate um yeah, that's what you've just said, isn't it?
Yeah,
Sorry, my brain
yeah.
is just a bit distracted this week.
No, yeah, that's what I do. So prescribe. So usually I would see patients post-diagnosis. So when they get diagnosed, then I'll run their first initial consultation. And following our conversation, we could decide which part we're taking, if we're going down the stimulant part or the non-stimulants. And then I'll prescribe and typically do a review in 4 weeks' time, see how they're getting on with it, if they need to increase the dose or reduce it, if they're experiencing any side effects, and if they think it's working for them, if they want us to try something else. And yeah, we're just so typically that's a standard day.
Yeah, you've obviously just said like stimulant and non-stimulant. Now I know ADHD medication is something that a lot of people don't really want to talk about, or it's very controversial and it's a
Yeah.
very personal. It's a very, very personal thing for each person. So say for instance, I came to you, I was diagnosed in 2008 19, age 43. So for instance, I've been assessed, I'm diagnosed, and then I come to you and then like as a woman, because I know that there's just no kind of there's no I'm going off on a tangent now. But so yeah, what would the first steps be? You talk to me about kind of the different medications and how they work, and is it different for men and women? Is I think what I wanted to ask.
The answer to that would be no. So the NICE guidelines, which we use here in UK, which is obviously what we would every prescriber in UK would use, recommends our first line treatment as methylphenidate. So that's the same for everyone, whether you're a man or a woman. There are differences, obviously, in terms of how we would respond to it, but just like every medication, everyone has different genetics, different biological, environmental factors that affects how you respond to a medication. And should I say, fortunate for us women, we've got the hormones also in play, which tends to also affect ADHD symptoms and how you would respond to the medication. So we do find like sometimes maybe a particular time of the month, women would need an extra dose to maybe tie them over, or they can find that their medication is not working as well as it did a couple of weeks ago, while that it tends not to be the case in men. So that might be like the sort of differences. But in terms of picking the tablets, it's all there. So it doesn't matter whether you're male or female. It's more like because so I'll use methylphenidate for example, which is a stimulant. It's more what part of the day do you struggle with more, because then you could get like immediate release that works for 4 hours and then you're fine, or you could get like if you work longer shifts, maybe you might need something that works up to 12, 13 hours, then that would help us decide. So back to your original questions about if you got diagnosed and you were sent to me, what would happen? So normally in a typical consultation, obviously it would be how you're getting on, if you had any questions about your diagnosis, if you had concerns, if you understood why, you were diagnosed with either combined or if it was predominantly hyperactive. Or, so we would discuss that and have a chat about that. We would discuss about the different options on the table, so the stimulants and the non-stimulants. And some people actually tend not to want medication. Maybe they just wanted some education on over it, or we could discuss strategies. We could discuss um, maybe putting structure in place as to going down the pharmacological path. So there are other things. And quite honestly, research has shown that ADHD treatment is more of a multimodal treatment. So it doesn't actually respond to just one thing. It could, medication could be a piece of the puzzle, but it's not the whole puzzle. So even if you're on medication, we still discuss having structure and organizational prioritizing things and having a bit more focus time. So we do have conversation about that. If you do choose to go down the medication part, then we talk about side effects, because unfortunately that's something that can be associated as well. And with ADHD treatment, the goal is to get the optimal response from the drug without getting side effects. So they go hand in hand. So we spent some time talking about that. And there are steps as well that you could take to manage side effects. So you can still take the medication and still get the benefits of the medication, but with minimal side effects. So that would be something we would discuss as well. It's really important not to feel pressure when you're spending time with your medical prescriber. It's very important to think about the treatment goals that you want, because again, you're not going to start taking the treatment and voila, everything is sorted. It's still, it still takes time. So it's good to set expectations. It's good to have treatment goals. And I don't want to go too clinical, but it's also good to have like a baseline. So we check things like your blood pressure, your height, your weight, all those matters before we proceed to prescribe. Make sure that it's safe. Medical history, if you're taking any other medications, how they would interact, what effect you're hoping the two medications could result to, and how we could better manage that. So we spend time talking about that as well. It typically would take maybe 50 minutes to an hour of conversation before we decide to proceed to prescribe medication. And yeah, that's typical. And then we book in a follow-up appointment in 4 weeks' time, see how you're responding to the treatment, and then we can take it from there.
Do you know what? It's really, I was just thinking, like, just listening to you explaining that, like, it's really nice to see someone who doesn't have ADHD talk so passionately about ADHD. I don't know, just, or I know we're talking about medication and so,
Yeah.
but yeah, but it is really nice because a lot of the time I kind of look for ADHD people to talk on the podcast, but I've kind of started thinking in the last few months that I need to kind of start branching out So having guests that don't have ADHD but may support or work. So it's really nice for me to just see that passion coming through
Oh, there is
you
quite a
as you're
number of us
talking
out
about
there.
it. Well, I
There is,
know, but I
you
know,
know,
but
I know what you mean. I feel like and even on my LinkedIn page, I've started a new, series about myths of ADHD, and I think it's really important that we talk about it because one of the ones that you get is, well, everyone has ADHD, or or maybe you could hear like ADHD is not a real condition, so you could hear things like that. And it's really, really important that we have those conversations and we clear it out that ADHD is actually a neurodevelopmental condition, right? We know that research has proven that to us. We probably have people with ADHD in our household or really close in our cycle, so we've had lived experiences as well. So it's really important that we share that information out so everyone is aware of it, and not make stereotype comments or
yeah.
dismissive comments about it, I should say.
I'm glad that also you said that even if you do prescribe medication and the patient doesn't, it's a positive effect. It doesn't necessarily mean that all of the ADHD symptoms are going to go away.
No, yeah.
And I like, you may have slightly said it in a different way to me, but yeah. So what is the difference between the stimulant medication and non-stimulant medication, please?
Okay, so in terms of the differences with the stimulant medication, so the stimulant medication so works on the chemicals like the dopamine in the central nervous system. So there's more. I know people get concerned about if that might cause addiction, or if it's how do I'm trying to get my words straight. So I know there's been a lot of conversations around stimulant, but it's almost like saying coffee. Coffee is a stimulant, right? And people do drink coffee. And I know that there's a misconception as well because you say you need to have a medication break. People then assume that it's because of a negative thing, but actually historically it's because people had symptoms worse at some particular time. So if you're in school, for instance, but then on the summer holiday, you're no longer in school, you probably then would cope better with your symptoms, but it's not because it was addictive to you. So in terms of picking the choices, again, it's just a personal preference. Some people might want to avoid that, which is fine. And I would say maybe the key major difference would be the way how it works. So with the stimulant working in the central nervous system directly on the dopamine receptors.
And what about the non-stimulant medication? Sorry, I got a bit distracted because it's just done a big clap of thunder here. So I
Oh,
apologise if you. Sorry, but so yeah,
no,
the
that's absolutely fine.
stimulant works on the central nervous system. The non-stimulant medication.
So we have the non-stimulant medication, which is the atomoxetine. So it's a little bit slower in the terms that you probably need to take it for at least 2 to 3 weeks to start to notice an effect. It could even be more before you notice an effect from it. So that's one. I don't want to use the word downside. That's just one thing to consider that could be different. Um, it works on the receptor norepinephrine as well, so it is slightly different, but it's still a chemical that is being used. I would say in terms of mechanism of action, I'm trying to think of the best way to explain it without sounding too too clinical.
You can sound clinical if that's the only way you can explain it. I mean, I don't mind. I'm sure the listeners
Let's
won't mind either.
see. Yeah, okay. So we could try. Let's try using maybe an airport. So imagine the brain is like an airport, a busy airport, right? And the planes coming in, planes taking off. That's all like the different symptoms, so all the tasks that you have to do, and distractions and everything else, right? And the tower house, that's what controls it. So that's what says flight A, you can land in this terminal, or you can go over to the next terminal. That's it. So the problem in ADHD is that tower doesn't receive the appropriate signals. It doesn't get enough, or if dopamine is there, the body reuptakes it really quickly. It doesn't give the message a chance to fully transmission before it disappears. So the tablet methylphenidate would work by increasing that dopamine level in the tau house, or making it stay there longer instead of creating it. While with atmoxetine, which is a non-stimulant, it doesn't work in pre-cortex. It doesn't work there in the brain tower. It works a bit lower down, but it also has effects of working in other parts of the brain. So it's a bit less stimulating. I think that might be a better way to explain it, I think.
No, that's great. I love that metaphor or anagram or analogy. Oh, I don't even know what
Yeah.
the right words are, but
Yeah.
yeah, I love things like that because then I'm like, oh yeah, I understand that. So
Yeah. So, you
yes,
just need it because, and it's not, the tower is not broken, because if it's not, sending signals, it doesn't mean you just shut the airport down. It just means you create structure, or you create safe points for the tower to be able to work it more efficiently.
yeah, we could call it like the radio from the tower to the planes is a
Yes.
little bit faulty, let's say, and you need
And your
one
message is
base.
just not being, yeah, so they can't
Yeah,
just hear, did you say terminal one? Did you say terminal
yeah,
two? So you just
yeah,
try. And that's why sometimes you see having post-it notes, right? It helps because you're using a different way of transmitting that information. So you're putting like a little reminder there to
yeah,
say this needs to happen.
yeah. So yeah, no, it's a great way to explain it. Honestly, I love, and I do take I chose the stimulant route, and I take Concerta XL,
Okay.
and doctors just drive me mad sometimes. They just do. And so, what if you have someone that he is considering medication, stimulant medication? Um, what are the, without putting them completely off, what are the possible side effects of what of that first experience for them would
For them.
possibly be?
Um, I'll say the most common one we get would probably be loss of appetite. And you know, if you take, let's say, we're using, in your case, you're taking Concerta. I'm guessing you take it once a day in the morning, and it tends to last the all day. So you might find that you're not interested in having lunch sometimes. It's not, yeah. So you lose appetite, and it's easily managed, I think is the word to say. Again, with everything, and I think it's even everything in life, isn't it? Like, you weigh your risk versus your benefits. So if you're getting benefit from it, loss of appetite is something that can be managed. So I would probably then recommend, in the morning, you have a hearty breakfast, so you have your protein, your dairy milk. If you're going to have a glass of milk or anything like that, it should be a full fat milk. That way you're getting more calories in, or yogurt. Another way around it would be dinner time, because with like Concerta, for instance, it would probably last about 12 hours ish. So if you take it, let's say 8 in the morning, you might not even be hungry about 5, 4. Your appetite might still be lost. So you might have a bit of a later dinner, like 6, 7, but then have like a proper meal, like a proper balanced diet meal. So to account for not eating throughout the day. It also helps to meal prep, because sometimes even if you don't have appetite, but you have like a nice like sandwich or a meal, you're more likely, then it takes one hurdle off, and then you're more likely to encourage yourself to eat. So loss of appetite can definitely be managed well. Another one might be sleep. It might affect sleep. And then in that case, we just recommend taking it a bit early. So if you're awake at like 7 a.m., you could take it then. So before it's bedtime, it would be out of your system. So then you're more, that can easily be handled that way. We also encourage having like a good sleep routine, good sleep hygiene in place, trying to avoid the phones. I know I'm bad for it. I wake up and I'm on my phone as soon as I open my eyes, but trying to keep the phone away from the bed so that you can sleep a bit better. Journaling tends to be really good and helps with sleep. I think it's just the whole idea of taking it off your brain, popping it on a piece of paper. You're more like, you have more of a less noise in the head. to help with sleep. And blood pressure, it's another one that tends to be of concern. Again, keeping an eye. I know blood pressure is also a tricky one in clinics actually, because then people start worrying about their blood pressure, that they check it every day, and then that itself is like causing like is that you, Emma? I'm getting a lot of notes. And then it causes a ripple effect, doesn't it? How often do you check your blood pressure?
Yeah, and now my blood pressure goes high. Even I'm sure it increases as soon as I get the cuff thing out to test it at home. And they call it, I know in GP surgeries or medical settings, they call it white coat high
Yeah.
blood pressure, don't they? Literally, I think that's me as well because it's just, I'm just like, it's, yeah. And actually, and this might not be possible, but I have found when I don't have the medication, sometimes my blood pressure is higher. It's weird because I'm having to force myself to do things that might not be medically possible. But I am
Mm,
a little bit of a,
do you
a,
know
a
what
bit of an
though?
unusual case.
The first thing that crossed my mind when you said that is I was going to ask in terms of your symptoms, do you feel like anxiety as well? Because then being anxious could explain why your blood pressure is high. But you know, when you're taking your Concerta, for instance, it gives you more of a stable mood. I don't know if you noticed that with your meds, you have more
Yeah,
stable mood. You're not as anxious. So that
yeah,
could explain. It might, we could argue it's not a direct effect, but it is an effect. Like because you didn't take your meds, you're a bit more anxious and then your blood pressure then is higher. Totally
yeah.
makes sense to me.
But exactly, it makes sense to me. But obviously, sometimes I think medical professionals don't really listen to me. They just are like, oh, whatever. And it's like, they've obviously gone to medical school. You've gone to university and done your pharmacy. Did you do a degree in pharmacy before I say it? Yeah, you did.
Yeah.
Yeah, and then you've obviously done extra training to be able to kind of prescribe ADHD meds. But yeah, I do think like just yeah, because my blood pressure because I in the UK after
Mhm.
COVID there was a few years where they couldn't get the stocks of medication in, and Concerta was
It
one
was a
that
bit of a
was
shortage.
yeah, was one that was affected by that. And then unfortunately, they tried me on a few other brands and I was just like, no,
You
like,
get on well with it.
no, not at all. And then I actually got COVID really badly.
Mm.
The first strain of COVID. And then, since COVID, like my heart beats quicker than the doctors like it to, but it beats regularly in the same rhythm. It's not like it beats at around 90 beats per minute rather than 70 beats per minute. Um, and then, yeah, they messed around with kind of the idea. They didn't mess around, kind of having to swap and change the different brands and the other brands not working, and then having to kind of just go back and say, I need you to put me back on Concerta because, and thankfully by then the stocks were back in the UK and
And
I was
yeah,
able to get it. But for quite a while, it was a matter of ringing round the different pharmacies in the town where I live and trying to find if they've got that in stock. And if they haven't, then you had to go back to the doctors. And then there was just all of these things that needed, extra steps that for someone with ADHD, obviously. But anyway, thankfully, that's all in the past.
mm-mm-mm.
And so yeah, it's just I love talking. But yeah, I've said to my the medical professionals, ADHD consultant, I've said like basically that when because they reduced because of these things, they reduced my dosage down by
Okay.
half, and since then it's like the blood pressure has been kind of increasing, and then they wanted to put me on blood pressure medication, and I was like, okay, it's just another thing. And then I've finally got up to, I think it's 54 milligrams I take now. But I need them to be increased because I am, well, I'm sure I've gone past the perimenopause and I'm in the menopause stage. And I had a review with the prescribing person, um, clinician. Is that what you call them? Clinician.
Yeah. Yeah,
Yeah, so
clinician.
yeah, so I had a view last week with my clinician, and he said that they don't want to increase the ADHD medication until, because I take HRT and I've been taking HRT
Yeah.
for 2 or 3 years now, but I just don't feel like it's working as well as it did. So what he suggested is that I increase the HRT, and then in 6 months' time, he will then assess, or he will then consider kind of increasing the ADHD medication. And I'm like, "Oh, it's just it," but everything seems like it's a bit of a battle. And I don't know if the listeners have had
Yeah.
experiences with this, but because I have so many other health conditions as well, so I've got complex PTSD, fibromyalgia, depression, anxiety, trigeminal neuralgia, like a long list. And the medical professionals you said to me, yeah, you've got complex medical issues. And I'm like, no, I'm just medically interesting, which is quite a nice little
Love
reframe.
that. I love that. That's a better way to say it.
Yeah,
Well, actually, I do actually want to say, I do would like to offer an apology that you had such an experience and you feel like you're not being heard. I feel that it's definitely not one of our intentions, I would say, as
yeah,
clinicians. Like,
yeah,
we would like to make our patients feel heard, especially because the condition here and in general, all of us as human beings, we're all unique and we all have different ways that our body and genetics, due to genetics, like different ways our body will respond to things. So yeah, yeah, definitely, I apologize for that. But it sounds like, is it getting better now, would you say? Are you seeing the light at the end of the tunnel? Is it?
it's a tiny light, let's say, but yeah, I think because I'm currently studying as well, like I noticed that, my the brain fog, and I noticed that my ability to be able to concentrate for any period of time seems to have kind of just this. It's not completely gone, but it's minimal, let's say. So I know for myself that, um, like you said when you first talked about women and medication, like adding an extra dose in at certain parts of the month of their monthly cycle. But I think, yeah, um, I mean, the clinician that I had my review with last week actually did know about ADHD and hormonal fluctuations in women, which uh, I'm surprised, and I've been shocked to know in the past that my GP actually said to me, "You'd be lucky to find someone that does know about both." And I'm like, "What do you mean? What?" So yeah, it's nice to hear that there's progress has been made in these areas.
Yeah, and I think maybe it's okay. I think I would like to just chime in to say that it's okay not to know everything because it's practically impossible to know everything. But I feel like as clinicians, one thing we really need to do better is to say, I don't know, but I'm gonna find out. And I think we should normalize that as well. It's okay if they've not heard about it, but they definitely have resources to look into it and they should know where to find information about it. And yeah, and better educate themselves so they can help the patients. That's the whole point, I think, of being a clinician, to be able to help and be a positive influence. Every day research comes out, every day, something new, we learn something new. And yeah, but I think it's definitely well known now, I would imagine, that women do react, and research has shown it's probably down to the estrogen levels, and yeah, and that's why even in pregnancy symptoms can tend to be a bit different. But yeah, it's probably worth saying as well, maybe your audience might also have different experience. Maybe they would have had a clinician that was really helpful, or maybe they reacted differently. But I know just from my experience in community pharmacy, people definitely react to drugs differently, even if it's the same generic ingredient. It could be as little as maybe the dye in the tablet. So it could not, it doesn't have to be like the active ingredient. It could all be methylphenidate, but maybe one has sunset yellow dye or another different dye, and that could be what's causing the issue. Yeah, so definitely have an open mind, I would say, and be
Yeah,
ready to learn.
yeah. I
You
mean,
said
yeah.
you're in,
Go on.
sorry.
Sorry.
No, I was
No.
just going to ask, you mentioned you're in studying in university. Are you doing an ADHD course, or like does it
No,
have to do with ADHD?
psychology. I'm
Oh,
doing
psychology.
psychology. But it's, yeah, it's an undergrad psychology, and it's
It's really
kind
good.
of grown into something that's now fully focused on ADHD.
Amazing.
Yeah, it's yeah, because I always wanted to study psychology, but I just never really had the kind of the confidence even to consider doing a degree. So I study 100% online, so I'm a distance learner, and so it's a lot of independent study, which
Yeah.
for someone with ADHD obviously can be quite challenging
I was
because
gonna say that's not the best type. That
it's
is
not.
because you're heavily reliant on your motivation, your spark, and you have to, yeah.
Yeah, but I have kind of managed um to get some support in place that's been key to my ability to be able to study effectively.
That's good.
So yeah, I've been quite lucky. In the UK, through student finance, you can get access to disabled students allowance. And although it's taken me nearly 2 years to find a study skills tutor that I can work with, the lady that I've got at the moment she's just phenomenal. Like,
Well,
it's just completely
I
changed
love it when
like
things
my
click.
yeah, so it's just completely changed, and it's weird because once I'm accountable to someone else, then things get done, whereas if I sit here on my own and I don't have any tasks broken down into manageable chunks, or if I don't have the accountability, then I literally was just it's not even procrastination. Like, I get so distracted, like with even minimal things, that it just kind of,
It
yeah,
just
I
takes
just
so,
end up going
yeah.
mad. Yeah, so for me, it's been about getting specific support put in place, but more importantly, it's been about trying to learn about what I actually need.
Yeah.
And that's been the trickiest bit for me, is kind of, because people asked me when I first started studying, and I was like, I don't know. I've never done distance learning before. I've never studied a degree. I have absolutely no idea. I've got ADHD. These are the things that I find challenging currently. So although it's been a little bit, it's been hard work trying to find a study skills tutor, it's also, I think, taught me some really kind of a lot of resilience, a lot of self-advocacy, but also it's enabled me to kind of be able to say, right, this is what I struggle with, and this is what I need. And I think it's not necessarily something that a lot of students maybe would have the confidence to do. So
Yeah.
I
Yeah.
think if there are any listeners that are even at school, or in higher education, or even at work, if you feel overwhelmed and you don't feel able to kind of advocate for yourself, I'd just like to tell you that you can do it, because anything is possible.
Yeah,
Um,
that's true.
and all we need to do is we need to kind of just show up and ask for what we need. So maybe start by thinking, what do you need to get through your day? Or what do you need to work or study effectively? So yeah,
Definitely, I echo that. You mentioned body doubling as well, and it's definitely something, that has been a game changer for a lot of my clients. Like, just being able to, and I think it's what mentioning, actually, just putting it out there, like, because it's not only about being accountable, but it's also could be about mirroring the person that you're body doubling with. So definitely, choose the right environment. Yeah. How have you found body doubling?
it's game changer, literally. Like, yeah, because then I'm not just accountable to myself, I'm accountable to people that are going to turn up for the sessions as well.
Oh
So
yeah, that's right. You do offer section. You do that, don't you?
yeah,
How have
so
you
so
found it? Like, so,
So yeah, I've just started offering free body doubling sessions on a Monday morning,
okay,
10 a.m. to 12 noon UK time. I have just started, and actually there's been a few attendees,
that's
which
good.
has been really nice, and the feedback has been good. So yeah, again, if the listeners want to book in and come to I'm only doing it on Monday to start with for a few hours to see if it's needed, and then I'll expand it out. But personally, for me, with my studies, the body doubling it's vital, particularly when I'm working on admin or academic writing, which obviously needs my full focus and my working memory and every kind of all that executive functioning or executive dysfunctioning is when it needs to.
Dysfunction.
So, and I think even for people that work from home or that study from home, like the physical, like even though it's only virtual, but the minute that someone else is on the screen with you, and I do it for the project through Teams, well, the minute that someone's there, I don't know, it's weird. It's almost like I just click into work mode. If that does that make sense? It's
Yeah.
weird.
It's almost like a switch. So do you set goals at the beginning of the call?
Yes, yeah, yeah. People can set goals, but then again, they don't have to if they don't want to. If they haven't got any, if they just want to get on, you can have your camera on or off. The only ask is that everyone stays muted, so then we can just study or work kind of alongside each other. And then if there's people that attend that may have questions or may just need a little bit of support, then I can create like a breakout room and they can go into that as well. So yeah, people can drop in
Fantastic.
and drop out as and when they like. It's really laid back, really kind of yeah, I try and make it as inclusive for everyone as possible. So yeah, it's
It's
been nice
fantastic.
because it's only
Yeah.
week 2 this week, and there's been a few people that have attended, that are not people that I know already, which is amazing because it means that message is then getting out there, isn't it?
Love that. When you make a post and people that liked it and not people that are, it's fantastic. It's a fantastic feeling.
Yeah. And I want to offer, things like that for free, because I know, people, we're in a cost of living crisis, and I've got the ability to be able to offer the sessions for free. And that's because it's not just because I'm offering them for free, it's because they're so beneficial to me as well.
As
So if
well,
that is
yeah.
all at the moment, if that is all I can offer other people, is just the time or the space or the teams, let's say, the teams meeting just to turn up and so they can work alongside each other, then, if that's then I'm
It's
happy to do
fantastic,
that.
yeah,
So yeah, it's just a
definitely.
little, yeah, I'm still getting used to Teams because I'm used to Zoom. But yeah,
Okay.
it's yeah, just another one of them things. And also for me within my studies, another one of them things has been mind mapping. So mind mapping
Okay.
literally is a game changer. So you got me talking about education now. I'm sorry, but I'm going to talk about this. This
It's
is meant to
fine.
be
It's
about
your
you
podcast.
and ADHD medication,
No,
not
it's your
me.
podcast. We can talk about anything you want to talk about.
But
I remember mind mapping when I was studying pharmacy, actually. Back in school, so it used to be one of those things that it could go anywhere though, can it really? Once you start pulling up the map, you could go anywhere with it.
yeah, exactly. So I got the mind mapping software called MindView through DSA.
Okay.
And I think it's been the most useful assisted tech software that I have. Literally is a game changer. So I'll create a new map every module. At the moment, I'm studying occupational psychology and
Okay.
forensic psychology because they're the last 2 modules of level 5. Um, but yeah, like literally in the middle, like, whatever the subject is, and then I just add stuff to it as I go along, as the weeks go. And then, I've got
Yes.
a branch for introduction, a branch for main body, whatever it is that
Yeah.
I'm writing 2 case studies for these 2 modules. But then the thing that I like about it the most is then whenever I'm ready, I can just export it straight into a Word document. So
Okay.
whatever I've inputted into the mind map is then on a Word document, and then it just takes that cognitive load away
Amazing.
from being able to kind of, yeah. So it's seriously, any students, if you're studying in the UK, or you can probably pay for it. I don't know what the the prices, but yeah, I highly recommend. And you can get it to set like little timers, so you get it to click every time. Because I don't know about other people and with their ADHD, but I do like a little bit of a reward when I've concentrated or done something because it's hard work.
Yes. Yes.
The little kind of reward of seeing the clock click down, not kick down, to the project being finished is sometimes just, yeah. So
When you mentioned about the mind mapping, it made me think about also the input in why I think mind mapping works, why I believe it works really well is because it's personalized. And it made me think about because I was doing some work on creating a personalized planner because I feel, there's hundreds of planners out there, isn't it? Like you get the minimalistic ones, the fancy looking ones, but they don't tend to work, or you could get them and after 3 days you don't open them because obviously it's not tailored. And I think that's why mind map works really well because it's personalized to you. So anything that is personalized to the way your brain works or the way your brain was thinking, when you exported it to a Word document, it was literally just it's your head there, literally. It's your brain on that piece of paper. It's just amazing, isn't it? Just takes off the load and it makes it work. And yeah, I think for people listening, if you're worried about planning things and try the mind map, try creating a planner for you. You don't have to, purchase one. Try just making it. You could set, if you're good in working in blocks, you could do a planner for yourself to work in blocks. If you prefer to work like hourly stamp or join a body doubling session on Monday with Emma, definitely to get things done. That's another good one.
Tuesday, not Monday, sorry. Tuesday,
Sorry,
the body
just
doubling.
did you say Tuesday at first? Or did I get
I
it?
don't know whether I said Tuesday or Monday. It could
Apologies,
have either, it could have been,
Tuesday.
it could have been either of us that said it. Sorry. But
But
yeah, it
yeah.
could have been either of us. Um, but yeah, I mean,
What we're just trying to say is discover what works for you
yes,
and then work with it. That's what we're
yes,
getting
yeah.
at.
I think one of the main reasons why I do like body doubling, I love body doubling, but why I love mind maps is because it kind of triggers the creative side of my brain. Because in my academic writing, the biggest hurdle for me is getting started. So I
Okay.
can, and then sometimes I get kind of lost and even like go off on little tangents and add things, and you've just spent 2 hours trying to write 2 or 3 sentences, and that doesn't even need to be included. Whereas if I've got a mind map um, that's got kind of even just bullet points or minimal information on it, then once I've exported it into a Word document, then it's kind of got over that hurdle of trying to get started. And so, but also it breaks the sections down bit by bit. So that then enables me to be able to just go off and, you find the research and whatever else I need to include.
Yes.
Um,
And doing that gives you another fresh pair of eyes, like almost you're looking at it with a fresh pair of eyes, right? So you can then quickly think, oh, that bullet point doesn't actually fit in here. And then it saves you the time that you would have spent, writing it and then taking it off. Or yeah.
Yeah, and it's not just useful for ADHD students; they're useful for everyone.
Yeah.
These suggestions are not just if you're neurodivergent or you've got ADHD or whatever. These suggestions are useful, even for people in work. If you work remotely, if you work at home, if you study at home, it also just stops you feeling isolated or lonely because you've got the physical video,
Yeah.
virtual presence of someone else being there. But if you work fully at home and you don't see a lot of people during the day, then you're going to start feeling quite lonely, and that's going to affect your well-being and stuff. So yeah, I think it's really important to just open spaces like the body doubling for anyone that needs it. It's not just for ADHD people. It's for everyone.
Yeah.
So yeah, I'm glad that we've had this little conversation. You get me off on a few little kind of topics, and off we go. And it's like, yes. So yeah. Did you want to say something
No,
then?
I feel
I think we both went to say something, and I was like,
yeah.
sorry, I was just
No,
bonkers.
no, no, that's fine. I lost my train of thought, actually. You're going.
So is there any advice, any suggestions that you would want to give to someone who's just been diagnosed and is considering medication for their ADHD? Yeah, is there anything specific that you'd like to leave the listeners with? I know we've talked about it, but
Yeah, I would say one thing I would love everyone to be aware of is mainly because it comes up. So when I read assessments before I see a patient, there's always this grieving stage that people tend to go through when they get the diagnosis, um, or people thinking they've maybe wasted a lot of time not getting diagnosed, or let's just say negative thoughts, right, about it. And I just want to say to everyone listening that if you were late diagnosed, um, yes, it's a fact that you would feel, sorts of maybe a disservice, but it shouldn't be holding you back. You shouldn't be like, oh, because I'm in my 50s or 60s, then, what's the point? I think it's fine that, you just got diagnosed now. You can actually even look back and be like, I had this issue, I had this neurodevelopment issue, and I still, got here. That's a positive. I think we should always look at it in with that light instead of just being negative about it. And it's also very important. I think, yeah, so that's the first thing I'll say. I feel like even when you read stuff, I don't know about you, Emma, when you go around LinkedIn, you see a lot of like comments like lazy or grieving, and I just think it's we don't need to dwell on it. We know it's there. But we just don't need to dwell on it. And then the second thing I would like to say is in terms of going in with the mindset that the medication will fix you or would cure you, because that's tends not to be the case. So instead of trying to fit into a little box and make your brain do what it's impossible, like incapable of doing, just work with your brain and adapt new skills and learn new structures, put things in place that would make life easy. And just like Emma said earlier, in terms of the double burden, like you don't have to have ADHD, right? A lot of the strategies and the support out there, it all makes life easy. Like, who doesn't want a beautiful looking mind map on a Word document to make writing your project so much easier? Like, so there's really positives out there. It doesn't always have to be seen with a negative light.
yeah.
What do you think, Emma?
Yeah, no, but honestly, I agree. One of the main reasons why I wanted to start doing the podcast was because I was sick and tired of just seeing like negative, either misconceptions or, ADHD is horrific or, no, or DH, well, I can never say that one properly, but if you have
Yeah,
autism and ADHD together, then, it's traumatic
yeah,
and it's like, I don't kind of like that narrative because I think, even within psychological studies and neuroscience, like the negativity, if you think about something in a negative way, then it actually changes the brain structures, like the
yes,
the kind of and you've done your studying and stuff, and so yeah, it's just that's one of the main reasons why I just wanted to almost kind of help other people to be able to see themselves
yeah.
positively. And I know everyone's journey is different, but if you've just been diagnosed, then congratulations. Welcome to the club is what I would say to
Mm.
start with. Um, and yeah, I think I don't think it was necessarily a grieving process for me, but I just kind of had lots of light bulb moments where I was like, oh, okay.
That makes sense.
Yeah, and then everything just started making sense slowly over, a period of time. And then, yeah, now I'm obsessed with ADHD. I talk about it all the time, and everything, my whole life revolves around it.
I
My
was gonna
special
ask,
interest. Go
yes,
on.
but yeah, you developed a special interest in it now, and I like that. I think that you can have light bulb moments. You could be like, oh, okay, that makes sense. Well, it's you don't really have to always be negative about it, like or feel like it's been such a yeah, yeah, just look at it from a positive perspective and just think about ways that you could then now right? So it's not about labeling. You've been diagnosed, now you know what can you do differently to make it easier for you, to make it more palatable, like to make it more, what can you do? So I think we should definitely look at it in that way.
And the way that I would explain that would be just learn to harness it. so you can reach your full potential, which is pretty much what
Yes.
I try to do every day, and it doesn't always work. There are some days where I just think I'm just not going to try anything because it's not that it's impossible. It's just that my brain just won't it won't allow me to do. I don't know if that makes any
Yeah.
sense, but
No,
it's
no,
like
no.
I just choose not to give myself a hard time if I get up in the morning and I try and kind of maybe write some of my case study and I just can't think straight. And so then I'll just try and do something different that doesn't take up that high level of cognitive load in my brain and stuff.
That's okay, Emma, actually. That's okay. There's no prize out there, or a trophy, I should say. There's no trophy out there for a burnout Emma. Like, why, if you're not up to it, you're not up to it, and you're not in a competition with, anyone there. So if this morning it's looking like a slow morning, it is a slow morning. We'll just do,
Exactly.
yeah, we'll just keep it slow and we try again tomorrow. And it's and I think actually I should probably add this, that it is worth mentioning that there are people on medication successfully, and they can still have a rough day. So it doesn't mean that because you're taking like your medication and or you have the strategies in place and you're doing all the right thing, it's still possible
Yeah.
to have a rough day.
Yep, exactly. And I just think as well, like, get inquisitive, like, learn how your symptoms present or manifest, learn how your symptoms are. It's about learning about what the things that you find challenging and then trying
Yeah.
to put, um, like, your own reasonable adjustments in place or,
Yes.
self advocacy. And it's all about kind of just showing up for yourself, I think. And like I
Yeah.
say to anybody, like staff within my university, that if they
Oh,
want me to do something, I need specific kind of list and time frame. So I need a bullet pointed list of what I need to do, and also I need to know how long I've got to do before it's done. If it
yeah.
needs doing, if that makes sense. And that has kind of helped me in my personal life as well. So you know, and the more that I kind of do it, I think the more it empowers other people to do it as well. And it's not just because I've got ADHD, it's just because I need that.
Oh.
Because time is just, yeah, it's time is a concept that I don't have.
Honestly speaking, I agree with you. And like you said, it's not just, I've not been diagnosed with ADHD. And if you speak to my husband, the one thing he would tell you is I have no concept of time. Like it's just, and he keeps saying to me every day, time doesn't change. Time is constant every day. And I'm like, is it though? I've been awake since 7. Are we out of the door by 9? No, we're still literally looking for the shoe. We're still trying to eat breakfast. That is, yeah. So I have alarms set on my phone. 7:30, wake up. 7:45, wake the kids up. And it just is little adjustments that you make for yourself to make your day easier.
Yeah. And as human beings, there's strengths that we have, and there's ways of doing things that we can kind of just hone in on. I like a strength based approach. I've like a strength based approach has helped me to find kind of self acceptance around my ADHD and unmask. And that's a story for another day. But I think for any of us, like, find out what your strengths are and then
Yeah,
nurture them and
and
look
nurture them.
after and try, and then with the coping strategies in place. Sorry, distracted again. I think for anybody, like, find the things that you find challenging and put some adjustments in place, but also kind of, work to your own strengths, find out what your strengths are, and kind of tailor your approaches around your strengths rather than just eat. And
Yeah.
this is for anybody, anybody that's sitting there and thinking like in that negative kind of frame of mind. I can't do this, I can't do that, or I find this or that or whatever challenging. Um, sometimes by just saying it out loud to another person, it kind of takes the power out of it, if that makes sense. And then it enables, it could then enable you to kind of get on and get the job done. But I think, yeah, when it comes to like a strength based approach, you can do a VIA personality strengths test for free. You just need to, create an account and do it, and then just try and focus on with your coping strategies. Try and focus on the strengths, try finding ways that work well for you. And yeah, as women, there's going to be times when, even without the ADHD, like perimenopause and menopause is not pleasant.
Yeah.
It's just about giving yourself a bit of a break. Like yourself, you're probably, you're working full time, you've got children, you've got a house to run, you've probably got like a million things to do every day. And I can imagine that some days you're just exhausted. You just don't.
To be honest, yeah. Yeah, and it's very common. And I saw a post recently, and it really it really resonated with me, because it felt like I was in that bracket, because not only, everything that you've called, Emma, so you've got full-time work, you've got the house, you've got and there's a lot of people now that are sandwich carers. So they are caring for so they've got kids that they're looking after, and they've got their parents
Parents,
that they're
yeah.
looking after. So um it makes it all too much sometimes. So it's good to, yeah, speak out when you need help, advocate for yourself, and definitely put in your own reasonable adjustments in place.
Yeah. Yeah. So, people can go on their own journey of self-discovery if they haven't already.
Yeah.
But I think primarily for women, like just give yourself a bit of a break, sit down for 10 minutes, find 10 minutes in a day where you can just sit quietly and just kind of be like just still and not
Mm.
doing anything, which for some ADHD people that is difficult, and for a lot of non-ADHD it is. But I think it's for women, like we're trying to juggle a million different things, and I think sometimes we all just need to hear, just give yourself a break, sit down for 10 minutes in the quiet, have a cup of tea or a cup of coffee or whatever it is that you like to drink. No alcohol, I would suggest during the day. Yeah, but
I'm a pharmacist. I am not.
but
I'm not endorsing that.
exactly, neither am I. Um, but it's just about, yeah, just giving yourself a little bit of a break because you're probably juggling a million things. And I do think, there's a lot more pressure put on in today's society, a lot more pressure put on women, as in, we go out to work, we work full time, we raise children, we pay the bills, we have to, eat healthy and exercise. I'm just like, sometimes I'm
Be a
just,
good friend and be
yeah,
there
be a
and
good
show
friend.
up.
Yeah, 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 and be there for everyone. Then they need you, and then oh yeah, just it's when you actually think about it, and you're just like, yeah, it's almost like blows your mind. It blows your
It
mind,
blows.
doesn't it? So
It does.
yeah,
It does.
but anyway, it's been an absolute pleasure. Oh,
It
we've gone four
has.
minutes over. Like always with me, we always go over a little bit. Yeah, no, well, yeah, because we just started a few minutes past the anyway, sorry. I get easily
That's absolutely
distracted.
fine.
Honestly, I've completely forgotten how to pronounce your name now, so
Osayomore.
Osayomore. Thank you so much for your time
Thank you for having
today.
me here too.
It's
I
been,
enjoyed.
it's been lovely to talk to you. Thoroughly enjoyed. Um, I think you might be my first non-ADHD guest, which is
Really?
yeah, which is special in itself, I think. So yeah, yeah,
Well, thank
that's
you so much for having me. I've really enjoyed our chat, and it's
thoroughly.
lovely. Yeah.
Yep, sorry. Can I change over my prescribing to you? Probably not. No.
What?
If it was possible, then I would, because it would be so much easier. Anyway,
I'm here. If you've got any questions,
of
I'm happy
course.
to support.
Yeah. Thank you. Thank you very
Thank you so
much
much, Emma.
for that. And thank you for your time today. Yeah,
Thank
thoroughly
you.
enjoyed our conversations. And yeah, thank you for all the hard work that you do for the prescribing or for ADHD people. Like from the bottom of my heart, I thoroughly appreciate what you do every day. So
Thank you.
thank you.
Thank you very
Um,
much.
and yeah, I will put the links to your LinkedIn if you've got a website. I will put the links in the description to this episode, so the listeners or watchers can find you. And yeah, all I ask is that you will share the link once I've edited and it's up there and it's, all singing or dancing, which is never all singing or dancing for me because I've got ADHD and no patience with editing. So Yes. Anyway, so
Thank you
I
very much,
hope you
Emma.
have an amazing rest of the week, and thank you so much for your time
You
today.
too. Thank you very much.